ask you, please join us, the panelists of this panel. My będziemy teraz rozmawiać na temat znaczenia partnerstwa.
We'll be speaking about the significance of partnership, understanding, and developing patient's competence, which is a very important element of the cohabitation between patients and medical milieus and other stakeholders that operate in the market of health services provision. Before we start the presentation by VLATKA RADIĆ, may we have a short video clip that introduces us into the topic.
There's a lot of pride at Janssen for how we put patients first. It's embedded in our credo and guides the way we work. However, the role of the patient is changing rapidly. People are becoming more involved, educated, and engaged in their own healthcare. Patients inspired us to create an entirely new patient engagement operating model that's transformed the way we approach everything in R&D, commercialization, and product supply.
Hello, good afternoon. My name is VLATKA RADIĆ, and I'm a medical doctor working in pharmaceutical company. I'm very much privileged to have this opportunity to briefly present the Janssen efforts in closely working with patients, with collaborating and engaging directly. I believe that it will clearly show our common interest and common goals. So let me start. So as obviously shown in this very short video clip, patients have been at the center of what we do for centuries already. It is also clearly expressed in one of our binding documents, Credo, that patients are our first responsibility. So I would say it's not brainer, it's written, and it's a formal document for more than 75 years in Janssen. However, we are aware that the role of patients is changing. What does that mean? It means that we adapted the way how we operate on a daily basis. We understand that insights from patients are very meaningful and that we need to incorporate them throughout the life cycle of products from the very start. I don't know whether you see the pointer, but never mind. From the very start to the end. Why? Because your opinion matters in a qualitative terms. It does affect the solutions we are bringing, the innovative solutions we are bringing. That's why we really want to understand, what do you think about the treatments? What do you, sorry for technology is always less confident than people, so as seen. So basically, we really, at the global level, incorporate patients' opinion and patient insights in the development of our products. It means that we are interested to know how patients can get into the clinical trials, what is the most convenient, what matters to patients, so that we really try to build the solutions and fight for the outcomes that will really make the difference. Not from the clinical perspective only, but from the patient's view as well. So here you can see the whole cycle of developing the innovative medicines. And I just wanted to point it out a few examples where patient contributions impacted the results. Basically, once we asked the patients to help us in designing trials, we were in position to remove all unnecessary obstacles, which in the end resulted that there were no dropouts from the studies, and the clinical data was obtained much faster which again resulted in drugs being available sooner, so solutions coming quicker to the market. Also, we are interested in, might be small, but still very impactful details, like what patient thinks about the type of pills, the way of dosaging, or even, the device outlook. So once we were starting to adopt the solutions based on the feedback and input, we came to a much better solution. So the better medical devices and also the outcomes that are really mattering to the patients. I believe that, again, it's not incorporating the view just for doing it, for the sake of doing it, but for the final results, which with your contributions are much better. Which allow me to share a bit of a personal story or personal journey. So back in some time ago, I was appointed to this interesting position, Patient Engagement and Advocacy Lead for Central Eastern Europe. I must say, as you can see, there was a big question mark in my head because I saw so much need, but I didn't know where to start from. Of course, we are not sitting in global, so we cannot impact the big processes, but for me, it was finally not, it was a common sense solution or answer. It is direct communication with patients and patient organizations. Transparent dialogue, meaningful conversation. When we bring the knowledge in and we respect the knowledge patients are bringing in. And this ongoing dialogue basically validated all my assumptions. Indeed, yes, we do share the same objective. We all want to achieve better health outcomes. Common sense. Again, we need to work as equal partners. There is not one stakeholder who is more important than the other. In the healthcare ecosystem or the healthcare systems, all key stakeholders need to work together on a common objectives as an equal partners. This is very much important. And that triggered the way how we work. Of course, we work for patients, meaning bringing innovative products and helping resolving unmet need. But we also, in order to do it better, to do it quicker, we need to do it in collaboration, not only for, but really with patients as well. And how we did it in the region, when I talk region, it's Central Eastern Europe, so it's 9 countries, where we do share some cultural heritage, and also we share many common problems as well. So we organized one of the first things we did, we organized one meeting and we invited the hematological patient organizations in the region to a brainstorming session. And there, in an open conversation, which lasted for almost a whole day, we really gathered a lot of meaningful insights, saying that there is a need and appetite for learning. So people are willing to know more, and they are also in need to build the competencies to better represent patient groups, basically they are representing, so the whole patient population, which is not so easy in a complex system where formal roles are sometimes more of formality than a real impact point. Also, it was clearly expressed that we can share as a different stakeholders knowledge, but one of the key enablers to learn is to share learnings between each other. So patient groups with patient groups cross-country. I'm talking about organizations coming from Croatia and sharing their successes but also failures with the organizations from Romania, Poland, and vice versa. This peer-to-peer learning was something that was considered as very valuable. And that's why our activity ended up in forming Central Eastern Europe Network for Health platform with mission to fulfill these expressed and validated needs. In continuation, of course, after understanding it better, let me try to, yeah, here it is. So now it's too fast. Again, let me share that I trust more people than technology, although virtual technology is coming. So it was, the first findings were followed with the two events that happened last year, one in April, one in November in Budapest and following in Warsaw, where we dedicated a lot of time in improving the knowledge and building the capacity and capabilities of patient organizations. As you can see, the time was split to 3 dedicated themes based on the needs. Exchanging the knowledge, so best practice session, then key opinion leaders lecture, because all of us were also eager to understand the diseases in more details as well as treatment options. And the third part was training provided by the health economics experts who were bringing the basics of health economics and oversight of healthcare systems existing in the region, trying to remove the terminology barrier that sometimes is in a way when you are trying to build more systemic solutions. When you speak with the people in charge, the decision makers, sometimes you are the experts, but the terminology comes across and it's easier to it's tough to bypass it. So that was one of the sessions covering it. Now it's the opportunity to say that we also put the effort to translate those knowledge into the Polish environment. Last year we organized 2 key events in Warsaw, bringing together our close partners and also working with them, seeing some of them in audience, working with them in building the meaningful agenda, and also bringing Polish experts who could put the relevance to the materials and to the content, bringing it closer to the Polish environment. As you can see, the first meeting was announced just 1 year ago during first International Patient Empowerment Congress, which is nice to remember. Then this is the outcome of our work from last year. How did we arrive to Janssen for Patient as an online platform? Basically, we, as said, it is ongoing dialogue and conversation. And we asked, how do you feel about the face-to-face meetings that we organized? Extremely positive feedback. However, there was a very important suggestion. The suggestion was that the materials that we were provided are meaningful, but that they are needed as a point of reference for a longer period of time, because you cannot learn anything, hardly this quite complex stuff, in 1 or 2 face-to-face meetings. So we grabbed this suggestion and we started, this really prompted us to start working on an online concept, on a Janssen for Patient as a website, online platform, providing materials, tools, knowledge available to lay public, so without any restrictions. And we tried also, which is very important to mention, that we also want to remove language barriers. So we are providing those materials currently in 7 languages, plus English as, let's say, a master behind. And what can you find on this site? You can find materials and information related to several diseases where we find ourselves as experts, and we can guarantee that the information is reliable, not promotional, but related to the diseases and treatment options, but also very practical information that could help patients to navigate within the tough times of understanding the disease. The other part, which is very unique, is this advocacy part, and which I would say all of you are pioneering, being the representatives and being activists, fighting and representing the needs of others, not only trying to find the individual solution for your own case. So you can find a lot of materials on Advocacy Center that are intended to really build your knowledge, your competencies, but also your confidence that you are mastering the informations and insights coming from patients. So that's something that also can be used in inspiring the others to take more active roles. I know in my personal life many people who are not that, let's say, generous to invest their time and energy for the, let's say, improvement of the health situation of population, not an individual. And here I will quickly rush through some screenshots, simply trying to illustrate the content you can find. As mentioned, there are several diseases like prostate cancer, multiple myeloma, schizophrenia, and you can see the number of languages available. Also, not only the information on the site, it's not only about the disease, about the treatment, but there are more practical information. What are the patient support groups? What can you expect? Patient testimonials, which seems nice stories, but they are indeed very powerful in bringing the confidence of people. It's kind of a psychological support as well, knowing that you are not alone. We were, as you can see, announcing this event, which is ongoing streamline, and as mentioned, the Advocacy Center providing a lot of materials and tools on impactful patient advocacy, on health economics and healthcare systems provided by international experts. So I would really like to conclude with my firm belief and conviction that knowledge and competencies do matter. They do change reality in current but also in future world. And I really hope that this concept of Janssen for Patients, which is built on 3 principles, getting insights, providing knowledge in close partnership, is serving patient community well. That is our intention and hope, and looking forward to continuous joint work. So, bardzo dziękuję, yeah? That would be, thank you very much for your attention.
Thank you very much, VLATKA.